One of the common things that I see as urologists often is blood in the urine. It's never normal to have blood in the urine, and when there's blood in the urine, it can tip you off that other things are happening. Blood in the urine is called hematuria, and that's the medical word for it, but it really just means blood or hema and urine. Blood in the urine, it can be microscopic, meaning there's blood cells that are only seen under the microscope that confirm the blood in the urine, or there's gross blood, meaning it's visible blood. It's red blood that's in the urine that you see. This is obviously more alarming to most people, but it's not normal to have either one of those, and both of these really require some type of urological workup most times. The workup for these will often include what's called a CT scan, and that's to look inside, look at the kidneys, look at the ureters, look at the bladder, see if there's some reason internally that you're having blood in the urine. So that's with a CT scan. You always want to check a urinalysis. And really with that, you're looking for the amount of red cells. You're looking to see if there's infection. And you can even send the urine off for what's called cytology, where the urine is spun down and it's looked at under a microscope and abnormal cells are looked at. So that's called cytology. And then the last part of the workup for hematuria, the basic workup, is just a simple bladder inspection, and that's called cystoscopy. And that's where a flexible telescope is placed in the urethra, and the urethra is directly visualized, the bladder is directly visualized, the openings that come down from the ureters, the ureteral orifices, are directly visualized. But this workup is done for that hematuria. There's a lot of things that can cause blood in the urine. There's a list of hundreds of things that can cause this. Any kind of medical disease of the kidney, like nephritis, there's all these different types of nephropathies or diseases of the kidney that can actually show microscopic blood or even gross blood. So that's something to look at. Usually those nephropathies will also have protein in the urine. So that can be a tip-off when you check your urinalysis and there's protein. Sometimes that can tip you off that there's actually more of a renal involvement. Gross blood, when you start looking at gross blood or blood that's visible, then you, as a urologist, a lot of this shifts into looking for like tumors, like a bladder tumor, a ureter tumor, like a kidney pelvic tumor, or even like a kidney tumor can have blood. Anything with the prostate or the urethra, anything of this lower urinary tract also can show blood. And again, we're talking about malignant issues and cancerous abnormal growth issues. But one of the more common things that will cause blood is something like just a simple kidney stone. So you could have a stone in this tube, or a stone here, or even a stone in the bladder. And what it's doing is it's just rubbing on the lining of the bladder or the ureter or this kidney pelvis. And it's just causing a little bit of blood to drain out. It doesn't take a lot of blood to make your urine look red, red, red. So just a drop or two of blood will make it look really red and can be quite alarming to a lot of patients. But, with CT scan, you're going to find a lot of this stuff. That's why this CT scan is so important. Is with CT scan, you'll find 99% of stones. With CT scan. It's so sensitive for stones that you're going to see most stones. Some of the stones that don't show up are like Indinavir stones or matrix stones. Those are two types that really aren't showing up real well on CT scan, but unless you're on that medication, most of these stones are going to show up pretty easily. If you have a tumor, oftentimes the tube above the tumor is going to be dilated because this kidney's not going to be draining because of this tumor. You get a decent look at the bladder, and so, with contrast, a lot of times with this CT scan, they will actually give you contrast that helps light up this kidney and the contrast is excreted into the urine, and you can actually light up this ureter. It can also fill the bladder with lit up contrast, and you can see what's called a filling defect. And a filling defect is just something abnormal that's just not filling appropriately with contrast, and that's often what you'll see when someone has a fairly good-sized bladder tumor. So that's helpful with that. But when you're looking at blood in the urine, again, it's important to know it's not ever normal. It's something that should be looked into. It should be evaluated. Again, CT scan, urine, cytology, and likely cystoscopy for a full workup. You can increase your fluids. If you see blood in the urine, the best thing to do is just to increase your fluids and then talk to your doctor about, any blood thinning medications that you're on, whether it be Coumadin or Plavix or aspirin, anything like that. Any of those medicines are going to make blood in the urine more pronounced. If you start seeing clots or you're passing clots, that signifies a little bit more bleeding of this area, and sometimes a catheter needs to be put in and irrigated to get all these clots out and things like that. So most people just notice the red blood that doesn't clot. Increase your fluids, it should clear, but then it's important to talk to your urologist, talk to your family doctor, talk to your internist, talk to your urologist to find out what's going on. This is your health. Your health is important, and this is just one way we as urologists help take care of patients. So I'm Dr. William Stiles, board certified urologist, talking to you today about blood in the urine. I hope this has been helpful. If you like this video, you know someone that has blood in the urine, hit share, send it to them. Maybe they can learn something about this. Thanks for watching.